Some people say that having a hospital in your community is a luxury, maybe one that we can't afford. But if you're having a heart attack and you have to drive that extra 15 minutes into Santa Rosa to get treated, may make the difference between life and death. I mean, when Paul Drive was here, we were, again, the midpoint between the coast and Santa Rosa, and so, people coming from Bodega, even to get to this hospital, it's a good half-hour drive. So they have to drive an additional 15 to 20 minutes to get to Santa Rosa, find parking in Santa Rosa, that's if they're not in an ambulance. It's quite a bit more travel time, and if someone's having a medical emergency, such as an anaphylactic reaction, like if they're allergic to penicillin or a bee sting, they're not going to make it that extra 15 to 20 minutes it takes them to get to Santa Rosa. A lot of people I know personally from my patients, they moved here, retired to this area because we had a hospital. They felt comfortable moving here because they said, yes, we're in the country, but we're just 10 minutes from Palm Drive or just 15 minutes from Palm Drive, so if something happens, we have a place to go. And now those people are, kind of out of luck. The other reason Palm Drive is important is that for people on this side of the Arroyo, on this side of the county, in a major storm, the 12 is closed in the past, and you can't get to Santa Rosa, and someone having a medical emergency would basically be out of luck. Granted, that doesn't happen very often, but if you're the person having the heart attack at the time, that's going to be a big problem. So not having a hospital in town for me has made a pretty significant impact on my practice. We're having to go to either Healdsburg or Sutter to do our surgeries, and that's not only inconvenient, but it just creates a distance between my ability to care for my patients and where I live, which is here in Sebastopol. Also, for the patients that live here, it's a longer travel time, and on the way to surgery, it's more time to think about the surgery you're about to have, and on the way back, you're in pain riding in a car, and so that's, again, inconvenient and uncomfortable, but it can impact medical care, and then if you have a problem related to a surgery, then you've got to travel that same distance back, and again, you've just had an operation, you're having pain, and so it's a significant impact on the patient. Also, the distance between where I live and where I'm practicing medicine, it can be an issue as well. If the patient's having problems, it takes me longer to get there to see what's going on. If I meet a patient in the emergency room, instead of just driving a few minutes, I'm driving a half hour, and the patient's waiting for me all that time to see what's going on. So it's made a pretty significant impact on both myself and the patients that I'm having to take care of.